Does your baby's skin seem dry and flaky all the time? Here are some tips on how to prevent that. Hi, I'm Dr. Nancy Silva, mom and pediatrician in Wesley Chapel, Florida. And it's a common thing for newborns to have that peeling, flaky skin. The most common question I get asked is, how do I get rid of this? So bathing is going to be the most common way. They just peel. It's very normal. It can look like a sunburn, which is all this thick peeling skin. Not to worry about it. The other thing you can do is to add a moisturizer, kind of a moisturizer. You want a cream or an ointment, not a lotion. I know there's a ton of baby lotions out there, but they just don't last. They're more heavily water-based, so they don't moisturize the skin as much, and then they don't help all of that sloughing skin to come off. An important thing is, your baby's skin is very sensitive. The newborn is just out of the womb, just out of all of that amniotic fluid, and needs to adapt to the environment. So you do have peeling skin, but you have sensitive skin. You want to avoid any extras that are unnecessary. One extra that's unnecessary is a daily bath. Babies don't need daily baths. They really need local cleaning, especially around their neck, because the breast milk will drip and pour in there, or the formula will as well. They need cleaning around their diaper area because they're soiling themselves. And sometimes, under the armpits, they get very sweaty and you'll see dead skin just sloughing off. So you can go ahead and clean those areas as well. The buttocks, obviously, diaper area too. Those are the areas you need to clean multiple times a day. You can use wet wipes. You can use just what we call sponge baths, but basically soap and water and a cloth. What to avoid at bath time? You want to avoid things like a lavender soap. No scented soaps are needed for your baby, and it can actually be irritating for your baby. I remember with our son, I tried lavender at 9 months old, and he was sensitive to it. He's not allergic to it, but his skin just wasn't having it. So I tried it once, tried it a second time, and then I was like, okay, I'm done. It wasn't gonna work. Another big thing you want to avoid are bubble baths. Your baby doesn't need it. It is fun for you. Have your own bubble bath. Your baby doesn't need it. Simple, gentle cleansers are the best way to go. And as I said, avoid bathing every day. It's just not necessary yet. To help the dry skin not be as much of a problem and prevent the dry skin from becoming a bigger problem than it already is, you want to apply moisturizers that are creams or ointments right after the bath. So typically I tell everyone, you're going to wrap your baby up into a baby towel. You want to pat them dry, leave them a little bit moist still, so that when you apply the ointment, it's going to actually penetrate in deeper when your baby's skin is left a little bit wet. If none of these quick tips help, you do want to go see your pediatrician. Sometimes you can have your baby diagnosed with eczema. Sometimes there can be an allergic reaction that your baby's having to a particular food or a particular formula or whatnot. Most of the time it's not a particular formula, it's more that, is it the cow's milk, is it the soy milk, etc., etc. But your baby can have a number of allergies to different things on or in their body. So you definitely want to check with your pediatrician if these tips are not doing quite enough for your baby's skin. I hope you found this helpful. Please subscribe to the channel. Leave a comment below and let me know what you thought of this. Let me know if there's something else you'd like to hear. Also, you can go to my website, drsilvakidsgrow.com, and you can find some free guides and some trainings. Some of the free guides include Fever Tips 101, Mindful Mom 101, 30 fun family activities when you're bored at home, and more. So until the next time, be kind to yourself, and bye-bye.